after the lasers, what are the mainly factors, good factors of modern science to treat the diabetic retinopathy, and what are the good factors of Ayurveda to treat the diabetic retinopathy, and how kind of results we can expect from the Ayurveda or from the by Shalakya to the diabetic retinopathy patients. So you see the variety of complications of the diabetic retinopathy and the long standing duration. So it is a kashta sadhya in nature. Okay, when the patient is having around the age of 30 to 50 years, in this type of patients, the not only the diabetic retinopathy complication, but other complications, patient having a very great speed, because dhatus are new, dhatus are there, new, not a new, but it is a young adult. So there is a speed of, or the doshas are in a great speed in the body due to the age, because it's the working age. So the disease is spreading all over the body to the other organs, including the eye. And when the patient of uh, after 50 to the 70 years, the patient will come to the patient is coming to our hospital. That patient is having a very not a very great speed, but very a small speed to have the complications. But when the patient is came in the PDR stage, there is a very little chance.
Sir, you are not audible. Hemant sir.
Yes, ma'am. Hemant sir, you are
Shall
not.
I call it? Baviskar sir.
कुछ इशू है शायद.
कॉल करना पड़ेगा शायद.
जी मैम, आप एक बार कॉल कर लें उनको.
कॉल करो क्या? कॉल करते.
जी मैम.
Not audible.
स्क्रीन शेयर स्टॉप किया है.
Yeah, hello. It's
अरुण सर,
हेलो, हाँ सर, आप प्लीज ज्वाइन कर लीजिए सर।
सर आपकी बात हो गई है सर से?
मेरी बात जी।
जी, ओके सर। सुनीता मैम, सर ने ज्वाइन किया?
सर मैं सर से बात नहीं हो पाई, बिजी आ रहा है उनका नंबर। कोई और बात कर रहा था
डॉक्टर
क्या ऑन बिहाफ ऑफ?
डॉक्टर अरुण की बात हो गई।
हो गई ना? हाँ, बिजी आ रहा था।
सो सॉरी फॉर द इनकन्वीनियंस, बट ये कुछ टेक्निकल एरर्स। नो, डॉक्टर अरुण सर ने ज्वाइन नहीं किया है शायद।
सर ने किया ज्वाइन अभी?
यस यस, फ्रॉम वैशाली, यस।
Hello, I am audible now.
जी जी सर, यू आर ऑडिबल सर।
The slides are viewing, madam.
यस सर, स्लाइड्स आप
दिख-
स्लाइड शो पे डाल दीजिएगा सर।
Slide दिख रही है अभी मैडम?
जी जी सर, जी सर। सर स्लाइड शो ऑन कर दीजिएगा। यस सर।
Yes.
जी सर, जी सर।
You can see this slide. Within a 4 months, patient subsides all the cottonwool appearance. You can see in the OCT on the left side. You can see on the right side image of the OCT. You can see the cottonwool changes are less than the and patient is improved by 6/18 to 6/9. You can see this slide is the progressive analysis from March 9, 2019 to July 2019 within a 4 months. And around 6/45 partial to 6/9 partial.
Sir, you are not audible. Hemant sir?
हेलो हेमंत सर।
कुछ दिक्कत हो रहा है।
हाँ,
I think from the sir की side से कुछ। Hemant sir, you are not audible. अरुण सर ने शायद फिर से लीव किया है।
सर से बात हो रही है।
हेलो लतिका मैडम, हेलो।
जी
सर से मेरी बात हो गई है।
जी
सर वॉज नॉट अवेयर कि वो ऑडिबल नहीं है। मैंने उनको बताया कि सर आप ऑडिबल नहीं है,
अच्छा
फिर से ज्वाइन करने के लिए बोला है उनको।
जी
इसलिए बीच बीच में पूछना पड़ता है क्योंकि सर को पता ही नहीं था कि वो नहीं दिख रहे करके। हेलो।
जी मैम, जी मैम।
ये विजिबल हो रहा है सर?
जी सर।
यस सर।
Okay, okay, okay.
हाँ,
Sorry,
आता
there
जी
is
सर।
more disturbances of the network. Yes. So ये जो slide आप देख रहे हो ना, this is a progressive analysis of OCT. Within a 4 months, patient having the vision improvement from 6/45 to 6/9. You can see the each visit of the patient, visit first up to the visit 6. You can see the decrease in the macular edema. So what should we think to decrease the macular edema without anti-VEGF? This is the main concern of our lecture today's. Okay. And we know the limitations of anti-VEGF also. Still, anti-VEGF is a leading type of treatment. You can see in the modern science. This is the third slide. That patient, you can see that for the patient's left eye, duration is 5 years. The patient is followed my treatment around the 5 years, but you can see the age is 65, 64 years. There is a no improvement in the left eye after 5 years. That is non-responding macular edema. That is a case of NPDR. But patient is a brother of one of the ophthalmologists, modern ophthalmologists, because they know the limitations. They know the limitations. Okay. So they prefer send the his brother to my hospital, that you give the treatment to this my brother. Okay. But you can see her, this is the same patient. Okay. But after the 5 years, in the next year, after the 6 years completion of the treatment, you see the lot of improvement in the same eye. The improved after 6 years from treatment is going on from the 2018 to 2024. This is the last 6 years patient having the, we called as a CAH. Okay, this is the diabetic retinopathy macular edema, DME, is the case of DME, NPDR. Okay, but no vision improvement. You see, there is only a 5 feet vision to this patient. Okay, you can see in the left and the left side, you can see the very huge edema around 644 microns, and it reduced to the 72. On the left side, on the first visit, he has a good RPE, retinal pigment epithelium, when he present to our hospital. After the 6 years treatment, you see on the right side OCT, there is a RPE damage, totally RPE is damage. So the edema is gone, but treatment is vision is not improved. It is only by 5 feet. So this is a long-standing DME if there. So you can see the Dhatu Nash. This is a Dhatu Nash. When the whole RPE is damaged, so there is only 5 feet vision. There is a response of Ayurvedic treatment after a long period of time. You see the differentiation of the period of each and every patient. One patient you may have, if it is a young, you may have a very good result in early time. But in the late age, if you try the patient for the Ayurveda treatment, it is not responding, but it will respond after a very long time. you can see there is no improvement in the vision also. So you should counsel the patient that there is a treatment in Ayurveda, but diabetic retinopathy will come very early, respond very early, then there is a good improvement in the vision, or we can prevent the further vision loss. Otherwise, if Ayurveda treatment also not responding to the diabetic retinopathy is not responding to the treatment, then you should counsel the patient that there is a loss of vision also, if time is going, much more time is going on. I am audible, madam?
Yes, sir. Yes, sir. You're
Yes,
audible.
because there is a frequent loss, so that's why I am asking. Okay. So you see,
संप्रप्ति संप्रप्ति हवी है सर संप्रप्ति
yes. We can tell you the Samprati. Okay, slide is not going on.
Slides are visible, sir.
Slide are visible, no?
Yes, sir.
I am audible also. Okay. In this slide, you can see the red spots on the OCT. Okay. From the left hand side to the right hand side, you can see the progressive analysis of the OCT and the decrease the macular edema. Okay. Then that same patient, but it is a progressive analysis from the first visit to the last visit. You can see the fundus photograph. Decreased hard exudates and also the macular edema, and patient is improved by the 6/18 to the 6/6. Okay, thus the other patients, you see in the fundus photograph, the microaneurysms and this cottonwool appearance are less than the after the treatment, you can see here. So why I show the slides previously, just everyone should know that yes, we can do the treatment, and we should heard this lecture very calm and quietly that we should also do the same line of treatment, or we know the limitations of the modern, and we know the limitations and plus points of Ayurveda also. So this Samprapti, every Shalakya is known, but you can see, to elaborate this Samprapti, I should say that the Siranusaribhir doshe vigunai ruddhamagataihi jayante netra bhageshu rogaha paramadaruna. So why paramadaruna is there? Each and eye problems or vision problem is a kashta sadhya in nature. Why this Paramadharuna is insisted by Susruta, or why Ayurveda insisted these eye problems as a Paramadharuna? Because not in modern science, but in also our science, if there is a vision problem, that is not easily curable. That Susruta know this very well. So सिरा की दुष्टि होने के बाद, जब दोष ऊर्ध्व भाग में जाने के बाद, जब हमारे रेटिना कोराइड लाइक ये धातुओं को जब दुष्ट करते हैं, स्थान वैगुण्य करते हैं, स्थान संश्रय करते हैं, और स्थान दुष्टि होने के बाद, धातु में दुष्टि होने के बाद, ये व्याधि परम दारुण हो जाता है. सो दोष जब चल अवस्था में है, तो वही उसको जो सिरा में ही है, जिन्होंने स्थान संश्रय नहीं किया है, स्थान दृष्टि नहीं की है, तो उससे पहले ही उसको ट्रीट कर देना चाहिए. सो वी विल गो अहेड एंड वी विल सी द स्टेजेस ऑफ द आयुर्वेदीय संप्राप्ति of diabetic retinopathy. Not only the diabetic retinopathy, but vision related problems of all the problems, all the diseases, whatever said in the modern science. So आमाशयगत विगुण दोषा सिरानुसारेण ऊर्ध्वगति नेत्र रोग, which is a parama daruna in nature. So not only the diabetic retinopathy, but also the retina macular edema due to the BRVO, due to the CRVO, or otherwise due to the posterior uveitis. Okay, so ये all व्याधि में आप इसको परम दारुण बोल सकते हैं. So Why these Paramadaruna insisted that you should go very early to treat the patient. Means patient प्रथम पटलगत या द्वितीय पटलगत या तिमिर लक्षण में ही है तो उसको ट्रीट कर देना चाहिए. अदरवाइज ये कांच में चला जाएगा. It is in third patala and the fourth patala, then it is a Paramadaruna in nature. So what Samprapti said, what Acharya said, that you should avoid this stage. Treat the patient in the Timir Avastha. Treat the patient in early stages of vision damages. This is very, very important because so that's why not only the Daruna, but it is a Parama Daruna in nature of every macular edema, not only the macular edema, but also the complicated macular edema. Okay, simple macular edema is in CSR, it is very easy to treat, और अदरवाइज इट इज सेल्फ कंसिंट, वो अपने आप ही ठीक हो जाता है. ऐसे भी है, लेकिन वो रिकरेंट है तो देन वी हैव टू गिव द ट्रीटमेंट. You know, when we go to the Ayurveda treatment, you should know these two slides. You should know these two shlokas. Everyone knows this. Roga sarepi mandegnu sutra mudrani cha ajirnan malinai chaner jayante mara sanchaya. और अदरवाइज रोगा सर्वेपि जायन्ते वेगो दीर्ण धारण ही. आचार्य वाग्भट ने अष्टांग संग्रह में सभी रोगों का मूल कारण अग्निमांद्य बताया है. When you treat the diabetic retinopathy, you should treat his GI, all GI problems. उसका पेट साफ होना ही चाहिए, उसकी एसिडिटी कम होनी ही चाहिए, उसको कुछ एलर्जिक राइनाइटिस है या अदर कोई प्रॉब्लम है वो भी ठीक होना ही चाहिए. उसका टोटल बल इंक्रीज करना है हमको. नॉट ओनली द डायबिटिक रेटिनोपैथी, यू शुड कॉन्सेंट्रेट व्हेन यू गिव द मेडिसिन टू द पेशेंट टू सी दीज रोगा सर्वेपि मंदेग्नु एंड रोगा सर्वेपि जायन्ते वेगो दारिण धारणै. You should know the pathya. You should know the lifestyle change. You should know the lifestyle, whatever the lifestyle changes you said to the patient. It should be implemented. So it is not only the diabetic retinopathy treatment, but it should be a whole body approach. Yeah, whole treatment approach. The every Shalaki should be a Kai Chikitsak. Then you can see the diabetic retinopathy in your view. Otherwise, diabetic retinopathy can escape from your view. Because if you are not treating, only giving the treatment that Trifalagrut and Anjana, Bidalaka, Tarpanadi, बस ये शलाक्य में हो गया तो चलो आपकी ट्रीटमेंट हो गई. Not like that. Every macular edema patient, you should go by these all the Ashtavidha Pariksha of patient. You should treat his other problems also, because not only the Netra Bala, if patient having his whole Sharir Bala is in Uttam, means वो अच्छा हो जाता है, उसका बल बढ़ता है after your treatment, then Netra Bala will increase permanently. Otherwise, you cannot treat the diabetic retinopathy. You should be a Kai Chikitsak. When patient is having a Agnimandya, you cannot treat the diabetic retinopathy. You should treat the Agnimandya first. वो ऊर्ध्व दोष है. You see, सिरानुसारी भी दोषी गुण ही ऊर्ध्व मागत ही, उसको अधो करना है. उसको ऊर्ध्व नहीं होना चाहिए, उसको अधो होना चाहिए. ऊर्ध्व हो गया तो जायन्ते नेत्र भागेषु रोगा परम दारुणा. So variation is very important in this. This is the basic principles of Ayurveda. If you treat the diabetic retinopathy, otherwise you can give the direct Saptamrit Loha, Triphala Gugul or Chandra Prabhavati and Manjishtadi Kashay Vati, या otherwise तिमिर में जो कुछ बताए गए हैं ये आप सिर्फ कांच की दवाई दे रहे हैं. ओके, विजन के लिए सिर्फ दवाई दे रहे हैं. तो ऐसे ही लोग लिखते हैं ना शलाक्य में कि बस हमको विजन से रिलेटेड ट्रीटमेंट करना है. नो, नॉट लाइक दैट. यू शुड बी अ काय चिकित्सक फर्स्ट. दिस इज वेरी इंपॉर्टेंट स्लाइड. सो अबाउट द एपिडेमियोलॉजी, दैट around 6% of total blindness due to the diabetic retinopathy in the world. This is a leading blindness in the people working in a working age, especially in the developed countries. You can see over here. So what we see previously, that duration of diabetes, it is very important in this diabetic retinopathy. Diabetic retinopathy itself came after the history of 5 or 10 years of the diabetic mellitus. The severity of the hyperglycemia. When the patient goes to the modern ophthalmologist, he see the condition, the what type of and the what stage of the diabetic retinopathy is there. It is a severe diabetic NPDR, or it is a severe PDR. So he is doing all the treatment like a lasers, intravitreal, or steroids, intravitreal steroids, to reduce the inflammation, to reduce the edema, or after the laser, the ischemia, it is reduced. वो पीडीआर में नहीं जाना चाहिए, इसके लिए वो लेजर्स करते हैं इन पेरिफेरी. इस्चिमिया होने के बाद में देयर इज अ proliferation of the vessels, there is NV, NVD. So that should not be happened. आयुर्वेद ट्रीटमेंट कैसे काम करती है, वो सीरा को कैसे ठीक करती है और डायबिटिक कॉम्प्लिकेशन को कैसे ठीक करती है, वो हम आगे देखेंगे. बट यू शुड नो द मॉडर्न लिमिटेशंस. वो इतना करने के बाद जब पेशेंट उनको पूछता है कि सर मेरा ये 5th एंटी VEGF है, सो वो पूछता है कि सर ये कितने लेने पड़ेंगे, द व्हाट इज द एडवाइस ऑफ दैट रेटिना स्पेशलिस्ट. What he said, that you should continue this anti-VEGF for a long time, every 2 months, 3 months, and you know the cost of the diabetic anti-VEGF injections. After multiple injections, patient asked to the diabetic retinopathy, diabetic retina specialist, that sir, how long we should continue like this? How long we should continue the intravitreal steroids or the anti-VEGF? When after all, what the answer is, you should go to the physician, and every time you should check your sugar. If your sugar is normal, then there is no any complications or no any further increase in the complications or reduce in the vision. So what he said, you should go to the physician. So what Ayurveda says, you should treat the Agnimandya first. You should treat the Prameha first. Not only the Kach, but you should treat the Prameha first. But Shalakya कैसे करेंगे? आप आयुर्वेद के फिजिशियन के पास भेजेंगे उसको प्रमेय ठीक करने के लिए? No, you should treat the patient because you have a basic B.A.M.S degree. So you know how to treat the diabetic. प्रमेय कैसे ठीक करते हैं, प्रमेय की अवस्था कफज, पित्तज और वातज में कैसे होती है. You should know the अवस्था of the प्रमेय. You should treat that avastha, then you can treat the diabetic retinopathy. You can add the especially drugs going towards the retina, drug going toward the netra bala, increase the netra bala. You can add in the prameha chikitsa, then you can treat the diabetic retinopathy. You can see these are the symptoms: blood vision, flutters, left vision distorted, dark areas in the vision, poor night vision, impaired color vision, and partial or total loss of vision in the severe stages of the patient. You can see how the diabetic retinopathy patient is see outside. There is a scotomas in the vision, and you see the pathogenesis. There are the two types. One is the microvascular occlusion, that is a ischemic pathology, and other is a leakage pathology, that is microvascular leakages. These are the two types vascular damages are there. Okay, and how the microvascular occlusion, everyone knows how it is acted. Okay, so going towards next is the microvascular leakage. There is a, due to the leakage, there is a macular edema. There is a lipid leakage from the vessels and causes the hard exudates and the retinal hemorrhages. These are the complications of your microvascular damages. Then there is a macrovascular leakages. You see in this slide, on the left side is the normal, and you can see on the right side there is a MA, microaneurysms. Okay, like that. These siras, no, now you know the sira. Okay, when you increase the bala of the siras, then you can prevent the microaneurysms. Then you can prevent the leakages. Then you can prevent the lipid leakages. Then you can prevent the leakages it is responsible for the macular edema. Leakages responsible for the DME, diabetic macular edema, which is very hard to treat. You see the difference between healthy retina and the diabetic retina. Grossly, it is a NPDR and PDR. In NPDR, these are the signs everyone knows because everyone is netra specialist over here. So these are the stages of NPDR: mild, moderate, and the severe NPDR. You see the microaneurysms. This is a sign of mild NPDR. In the moderate NPDR, you see the microaneurysms, hard exudates, flame-shaped hemorrhages. This is a moderate NPDR. And in severe NPDR, you see the macular edema. Because it may be a diabetic macular edema only. And this is a intraretinal lipid exudates due to the leakages. This we call it as a hard exudates. And what about the soft exudates? This is a white fluffy lesions in the nerve fiber layer. You see this is the quadruple appearance. Then next is a severe, is a PDR. 5% of DM patient you see the PDR stage. What are the findings in this? Than the NPDR, here is the neovascularization, NVD and NVNE, and the vitreous changes and the vitreous multiple times of vitreous hemorrhages due to the NVD or leakages of NVE. And about the advanced diabetic eye disease, final stage of uncontrolled PDR, there is a secondary glaucoma, we call it as a neovascular glaucoma, and the blindness from persistent vitreous hemorrhage. There is no hemorrhage is absorbed naturally, or otherwise patient may have the vitrectomy and other intravitreal interference. There is a tractional retinal detachment, opaque membrane formation, that is the epiretinal membranes, and all these. You see in the PDR, you see the NVE, venous bedding, IRMA, intraretinal microaneurysms. Okay, this is the IRMA. This is the stage of PDR. You see the vitreous changes, and on the right side and the left side, you see the vitreous hemorrhage. This is the vitreous hemorrhage and abnormal blood vessels in NVD. This is. So you see, this is a NVD, neovascular at the disc. This is also see the other slide, and this is the tractional detachment PDR. This is a very severe stage or the last stage of the PDR, and this is a complication. You know, the neovascular glaucoma is not treatable actually. When there is a anti-VEGF to regress the vision, to regress the vessels, then glaucoma will subside, but it will reoccur in the future also. And the diabetic retinopathy we called as a DME. This is the leading cause of legal blindness in diabetes. Patient not having any other peripheral or any other quadrant damages, but persistent macular edema is there. We called as a DME, diabetic macular edema, present at any stage of disease. It may be a mild NPDR, may be a moderate or severe, or it may be in PDRs. Okay, more common in patients with PDR. So what about the DME? This is a thickening of retina at within a 500 microns of the center of the macula. We called as a DME. You see how the OCT of the DME of the patient of macular edema, you can see. So what modern says is the primary prevention, strict glycemic control, blood pressure control. In secondary prevention, annual eye checkup, and tertiary, in tertiary phase, it is a retinal laser photocoagulation, we called as a pan-retinal photocoagulation, PRP, and other is anti-VEGF, and the third one is If not vitreous hemorrhage, persistent vitreous hemorrhage there, patient needs or tractional retinal detachment TDR is there. So vitrectomy and the membrane peeling is there. So you can see the photograph of PRP. These are the anti-VEGF injections given. You see this patient needs the vitrectomy if there is a persistent vitreous hemorrhage. And what is the conclusion of modern science? Modern science said that diabetic retinopathy is a preventable through strict glycemic control and annual dilated eye examination by an ophthalmologist. This is the motto of modern ophthalmologist. So now going towards the Ayurveda and the diabetic retinopathy. So diabetic retinopathy is a prameha upadrava, needs prameha chikitsa plus panchakarma chikitsa. Not only the shamana chikitsa, but patient needs the panchakarma chikitsa. If patient bala is uttam, or you should treat the Agnimandya first and then go for a panchakarma. Otherwise, you may land the patient in the other upadravas of the panchakarma. So increase the bala of the patient first, then go for the panchakarma. And in second, in diabetic retinopathy, Timir and Kacha Avastha or Linganash Avastha needs Netra Chikitsa. You see, there is a Prameha Chikitsa plus Netra Chikitsa, both, and the Kriya Kalpa, according to the diabetic retinopathy. Above treatment is for a diabetic mellitus and the lower treatment is for the diabetic retinopathy. You know this slok, very, very important. Everyone is knows that in the first year of B.A.M.S, we know the prayena sarve nayanamastu bhavante abhishanda nimitta mulaha tasmat abhishanda mudriyamanam upachared ashu hitaya dhimana. I am highlighted these two words. Prayena sarve means सब जो प्रॉब्लम्स है नयन के या नेत्र के कोई भी हो, not only related with the diabetic retinopathy, also like scleritis, your corneal diseases and all other problems of the नेत्रा. So उसमें सबसे जल्दी से जल्दी आपको उपचार की दिशा उसको देनी चाहिए. Why it is? उपचारेद आशु हिताय धीमान, बुद्धिमान वैद्यों ने इसको जल्दी से जल्दी ठीक करना चाहिए. अदरवाइज दे डैमेज द धातुस, दे शो द complications like a स्थान वैगुण्य. You see the corneal opacities. You see there is a thinning of the sclera in scleritis, chronic scleritis. So you should treat very early. Means first year में और शलाकी में क्या difference है? You should know each and every word. You should know the importance of उपचारेद आशु. लेकिन फर्स्ट ईयर में या बीएमएस होने के बाद या जनरल वैद्य को ये पता नहीं है. वो सब सिर्फ पढ़ लेता है, प्रायण सर्वे नयनामस्तु अभिषंद उसका मूल कारण है और उपचारेद आशु देता है दिमाग, उसको जल्दी ठीक करना चाहिए. ऐसा नहीं. You should think in the deep. Why it is important? This slok is very important. You can see the differential diagnosis of Timir Kach Linganash. It is a Patalgata Vyadhi, and you see the Sarvagata Vyadhi on your right side. On the left side, you can see the symptoms: pain, redness, watering, foreign body, photophobia, lid edema. Okay, these are not present in the Timir Kach and Linganash. If there is a complication of Timir Kach and Linganash, like a neovascular glaucoma, then it land in a Sarvagata Roga. Not it is in the Timir. It comes in the other patala also. It comes in the means it is a condition of whole netra. Sarvagata netra. Sarvagata means all the parts of your netra. Not only patala, but all parts of your netra. So these Sarvagata Vyadhi are ashukari in nature. So if the glaucoma especially comes in this category, adhimantha, but in other stages of glaucoma, like primary open angle glaucoma, you see the lakshana of Timir Kach and Linganash. There is no lakshana of Adhimantha. So, but you can, when you do the fundoscopy, you see the damages of um, disc. You can see the cupping of the disc, but there is no any symptom of the patient. So it should not go in the Sarvagata Roga. It is in Timir Kach Linganash. It is in Patala only, not in Sarvagata Roga. So primary open angle glaucoma comes in the category of Timir Kach Linganash. But in acute stages, in closed angle glaucoma, acute angle closure glaucoma, it is as a Avishanda. It is as a Adhimantha. If not treated, Avishanda, it goes in the Adhimantha. That is, Abhishanda is a Sarvagata Rog. Adhimantha is a Sarvagata Rog. You see the symptoms on the right side and you see the symptoms on the left side of Timir Kach Linganash. You can find diminish of vision and sometimes a headache in Timir Kach Linganash. If Timir Kach Linganash patient is there, only Patalgata, like a diabetic retinopathy, the blindness comes after months and years. But on the right side, you can see, this is very important slide, when the doshas are sarvagata, means they are, means उन्होंने सब नेत्र को व्याप्त किया है, तो ये सर्वगत रोग में आ जाता है. So, how is the vision? The blindness comes in a days and in the month. It is very ashukari in nature. This is a differential diagnosis. So, here is, you can see the Timir Kach and Linganasha. Timir, I showed in a green color, yellow color, and the you can see the last red color. Timir is a sadhya in nature. So it's very good to treat, no any problem. In this avastha, every patient, every Shalakya should treat, and patient gain total, means total vision will come back in this stage. But we can't say the total vision will come in the Kach avastha, because it is kashta sadhya in nature. So it showed in a yellow color. And everyone knows that Linganash means there is no vision. Except Kafaj Linganash, that is treated by the Shastra Karma, what Sushruta said, Kafaj Linganash Shastra Karma. Other Linganasha, Pittaj and Vataj, it is totally not curable. It is asadhya in nature. You can see the slides. I am presented this in the refractive error cases. So here is the words of refractive errors. But you should concentrate on the Timir Kach Linganash only. What about the Pratham Patala? This is Avyakta Rupa. No see clearly. There is no doshas. If you do the fundoscopy, there is no any problem. But patient having a vision loss, you can see if there is a spectacles or not. This avastha is a avyakta rupa. No see clearly only. But there is no any pathology inside the retina optic nerve when you do the fundoscopy. Occupy the first patala only. Vyasa guna of vata. This is only a sthana vaigunya. You see, only the sthana vaigunya, not the sthana drushti. There is no sthana drushti. So there is a retina optic nerve. It is very healthy in nature. So there is only the sthana vaigunya due to the vyasa guna of the vata. And with the as per Sushruta, when the doshas enter in the second patala, it's called as a kach. In according to the Vagbata, it is avastha of kach. What are the symptoms? Only patients feel flashes and flutters. Sometimes we feel some flutters when we do the fundoscopy. So doshas are in sira, chalaguna. What patient said, मेरे आँख के सामने कुछ तो भी घूम रहा है, but patient is having a 6/6 vision. So this is a second patalagat. Here is only a sthana vaigunya. There is no sthana drushti, so it is sadhya in nature. And all patients with vision damage, they came in your OPD. You can see this is a kach avastha. This is a third patalagata dosha according to the Sushruta, and the second patalagata dosha according to the Vagbata. So what patient feels? Patient feels the partial vision loss, and doctor can see the signs after the fundoscopy. But in this avastha, we cannot see any symptoms after the fundoscopy. So central, peripheral, or both areas, these all retinopathies comes in this category, Kach avastha. So what is the Paramadaruna? Though doshas should not enter in the third patala. Patient should not having a Kach avastha. So treat as Timir as early as possible, or otherwise patient land in a Kashta Sadhya avastha. So you see the last, doshas are in dhatus with a sthira guna, not in chala guna. You see, this is very, very important. Doshas are in dhatus with a sthira guna, and they are damaging the dhatus. Because with a sthira guna, they are on that place only, they are not in siras, they are in dhatus in this stage. So sthana drushti, you see the kashta sadhya and yapya condition. When you give the treatment, patient may have as it is vision, or he may have the further vision loss after Ayurveda treatment also. Everyone knows Linganash is not treatable. It is a complete vision loss. If it is a Kafaj Linganash, it is treated by the FACO or SICS surgery. Or see on the right side, it is Pitta and Vata Avastha. It is asadhya in nature. This is Indriyopaghat. Indriya Upaghat means पूरे इंद्रिय का उपघात होता है. All the means including the retina, including the optic nerve, everything is damaged. That cannot be reversed. That cannot be treated by Ayurveda also. बहुत सारे वैद्य हमने देखे हैं या हमने पहले सुना था कि यस पेशेंट को कुछ विजन नहीं है, उनको दिखता है कि अरे नेत्र तो काफी अच्छा दिख रहा है, कॉर्निया इज ओके, देयर इज नो एनी कंडीशन, देयर इज नो एनी सिम्टम except vision loss. We can treat the patient. Okay, we can give the Ayurveda treatment and patient may have the vision. But you see in the POAG cases, you see the eyeball is very calm and quiet. But patient, ऐसे बोलते हैं ना, कभी कभी हम बाहर निकलते हैं तो पेशेंट बोलता है सर मुझे काला गॉगल लगाना पड़ता है क्योंकि मैंने वो लगाया नहीं तो किसी को धक्का लग गया चलते वक्त, तो बोलता है कि यार तेरी आंखें तो अच्छी दिख रही है, आप झूठ बोल रहे हो कि आपको विजन नहीं है. That is case of POAG. That is a case of fourth patalagat doshas. Patient not having the disease, not having the vision, but patient see, but the other one is see the patient's eyes quiet and normal. So this is the Linganash case. So going towards the treatment principles of diabetic retinopathy of Ayurveda, treatment principles of the Kach. So this is the basic Chikitsa Sutra. Akshi Kukshi Bhava Roga Langanam Adhu Upacharit. Langana is the first line of treatment. What is the importance? Importance is when the patient came in front of you, you see the bala of the patient. Not only the patient bala also, but you see the Vyadhi bala also. You should not see what is the, it is a case of PDR, it is a case of NPDR, which is the case. No. You see the bala of the patient. If bala is uttam, in which age bala is uttam? It is only 40 to 60 or 60 up to the 65, up to the 70 we can say. If there is a good Rugna bala. Or otherwise after 60, 65 or 70, you see there is a Rugna bala is decreases because there is a 15 years or 20 years diabetic mellitus history. The Rugna having a diabetic retinopathy included, there is no, absolutely less, means Daurbalya is there, very severe Daurbalya is there. Patient cannot walk, patient needs help to walk also. So how are you going to treat the diabetic retinopathy in this case? You see the Rugna bala and the Vyadhi bala also. Okay. Then you can say that it is treatable or not. If Rugna bala and Vyadhi bala is Uttama, then first Panchakarma, then Shaman Chikitsa. Okay. The Rugna bala is Uttam, you can do the, if Agni is Uttam, you can do the Panchakarma first. Or Hina, you can first, you can do the Shamana Chikitsa. You can, you should have the Agni Mandya, it should go away. the patient having a good Rugna Bala after your Shaman Chikitsa, then go for the Panchakarma. These are the basic principles when you going to treat the diabetic retinopathy, or when you going to treat the Kach Avastha. You should treat first. You should give the Shamana Chikitsa first, and then go for the Dosha Shodhana. Dosha Shodhana, you will get very early results. But Bala is Uttam, you give the Virechana to that 40 or 60 years patient, you give the Koshta Shodhana or Virechana, Bala is Uttam, then you should see the very early results. Macular edema is subside very, very early. Or other complications of diabetic retinopathy is going to vary, because we are doing the Dosha Shodhana directly, not Pachana Chikitsa by Shamana. Okay, so Panchakarma is very, very important in this stage. If Rugnabala is important, this is a very basic Chikitsa Sutra when you are going to treat. Then going towards the treatment, Bhavanti Yapya Khalu ye Shadamaya, Harid Raktesu Shira Mokshanahi, Virechapi Purana Sarpisham, Virechano Pagitena Sarvada. Means, iska arth kya hota hai? Sira Moksha is very important. If there is no Amavastha, you can see. If you are doing a Rakta Mokshana, you should have the Nirama Avastha. You should give the patient first the Dipan Pachan, then you do the Sira Mokshana. Otherwise, you may land in the other complications of diabetic retinopathy or other complications of the diabetic mellitus. If patient having a nephropathy, you are doing a Sira Moksha, no, it will increase. So you should do the Dipan Pachan first. And what our Susruta Acharya said, that you should give the Purana Gruta. Purana Gruta is very, very important when you treat the Amavastha. Okay, there is need of Gruta, but you cannot give the normal Trifala Gruta, Timira Gruta, or otherwise the Jivantadi Gruta directly. You should give the Purana Gruta first, because it is when you give the Gruta, it may have the Agni, increase the Agniman there, but it is not a condition in Purana Gruta. That Purana Gruta having the guna of Agni Vruddhikara. So when we give the patient for the Purana Gruta, then it should be a very good in Amavastha. Then what is the third point? Nitya Virechana. This is very, very important. Why it is very important? You should know that Jayante Netra Bhageshu Rogaha Paramadharuna. Sira Nusarebhir Doshaihi Vigunai Urdhvamagatai. Means ऊर्ध्व गति में होता है तो उसको अधोगति देना ही इंपॉर्टेंस है. सो उसको अधोगति देना है तो उसको विरेचन ही इंपॉर्टेंट है. नेत्र रोगों में वमन त्याज्य है. व्हाई इट इज? बिकॉज उसमें वमन की गति ऊर्ध्व होती है, और नेत्र वैधि में भी सिरागत दोषों की भी गति ऊर्ध्व होती है. When you give the vamana, there is a increase the सिरा दोष, ऊर्ध्व मार्ग में जाने की जो गति है, ऊर्ध्व में जो दोष जाते हैं सिरा से, वो वमन के दोष से और बढ़ता है. मैंने एक पेशेंट ऐसे ही देखा था कि एक वैद्य ने डायबिटिक रेटिनोपैथी थी. इट इज मे बी अ मॉडरेट स्टेज. देयर इज नियोवैस्कुलराइजेशन व्हेन यू डू द फंडोस्कोपी एट द टाइम, and one Vaidya is patient having a normal vision, no any problem. But when that Vaidya is giving the woman to that patient, the patient land in a sudden vision damage due to the vitreous hemorrhage, or not only the vitreous hemorrhage, but there may be a epiretinal hemorrhages. There is a retinal hemorrhages after the Vamana Vega. So when the patient goes toward the ophthalmologist, they ask the history that yesterday I have the Vamana. So what they said, due to the Vamana, you have that the vision loss. So the Vaidya don't know which condition of the eye that woman should not give. So every Shalaki should know that if there is a neovascularization, if there is a retinal damage, you should not give the, if there is a problem in the vision, you should not give the Vamana Chikitsa. So this is in red color. Nitya Virechana is very important in this case. So the next, in acute condition, you can give the Purana Gruta, Alpasveda and Jalavka Avcharana. In acute stage, Samavastha. You may give this. Or when I becomes a quiet, Niramavastha, then Vatagnu Gutapan, Virechana, Sneha Basti, Niruha. You can give this Panchakarma Chikitsa. After a Sharira Shuddhi, use the Kriya Kalpa, which is more beneficial. You can use Anjana, you can use Tarpana, but after a Sharira Shuddhi, when the body becomes a Niram, then you can use the inner Kriya Kalpas like Anjana, Tarpana, Ashwatana. Or otherwise, you should use the extraocular Kriya Kalpas like Dhara, like Bidalaka, like that, to reduce the pain, to reduce the redness, or to have a snehana by applying the on the eyelids. This is very important. Virechana, Nitya Virechana. This is a Tilva Gruta. Bark is used in this. It is the best Virechak Dravyas. This is purgative in nature. Tilvaka. So, is the Sandhaniya in nature. Healing effect on the wound. Okay. If there is a damage in the macula, you can see the Sandhaniya. Okay. You can see the Sandhaniya effect of this Tilva Gruta. You see the Sonita Stapana Ganas, hemostatic in nature. This Tilvak. Okay. Shonita Stapana in nature. So you can reduce the vitreous hemorrhage. You can reduce the leakages. You can increase the bala of your siras. That there is no any macro aneurysms. There is no any proliferation of the vessels. Because the sira is in good condition after this Tilva Grutapan. Charak mentioned this in Vatavadi. Okay. In Charak Chikitsata. In Vidhradi. This is in abscess. These are the basic principles what you should think to treat the diabetic retinopathy. Then what medicines we Shaman Chikitsa medicines we are using in our OPD. So in Pramaya Chikitsa, Nisha Amal Ki Yoga is good. Everyone knows. Timira Gruta after Amapachan. I will show you what are the contents of Timir Gruta next slide. Chandraprabhavati, Manjushtadi Kashayavati, Santarpana, Apatarpana as per patient. You should decide it. So, Pathya is very important. And the medicine doses as per Rugna and Vyadhibala. When you give the Shaman Chikitsa, you should know, because in the chronic stage of diabetic mellitus, you see the Lakshana of Grahani also. The patient is frequently going for the वो मल प्रवृत्ति का वेग काफी बार बार जाना पड़ता है. 8 दिन 15 दिन 1 महीना होने के बाद में उसको ऐसा लगता है कि मुझे बार बार उसको मल प्रवृत्ति के लिए जाना पड़ता है. तो यू शुड ट्रीट द ग्रहणी फर्स्ट. You should treat this is also due to the complication of diabetic, chronic diabetic. You should the grahani first, then dharana kshamata of grahani is okay, then you give these above treatment. Before that, and if rugna bala is less, then you should go the shaman chikitsa in a less doses. Otherwise, patient not having a good bala, then when you give the treatment, the patient may have the complications of Daurbalya. Yeah, patient land in a severe Daurbalya condition. So the doses, this is a very important. You should see the Rugnabala and give the doses of your Shaman Chikitsa. These are the Swaras, Guruta, Churna, Kvata in diabetic retinopathy or in diabetic mellitus conditions. You can give this. These are routine medicines we are using in our OPD. We are using the Timir Anjana. This is a Vagbhata Yoga. Vala Pimpli Sendo Go Guruta Madhu. This is told by the Acharya Vagbhata. So this Anjana, this is a Tridoshagna in nature. You see the content of that. There is a Tridoshagna in nature. And this is a Timira Gruta. The Draksha, Ajadugdha, Trifala, Maka, Vasa. we are using the Maka and Vasa is Swaras in this yoga. We are using a Swaras of Maka and Vasa. So it is more potent. Okay. So it is more efficient to treat the diabetic retinopathy. And Siddha Gurguta, it is called as a Timiraguta. Drushtinasya, we are using that Tila Taila, Beheda Taila, and Maka Swarasa. But Bhagavata said in the Timir Chikitsa Adhyay, you can see this Timir Anjan. We name this as a Timir Anjana, but you see this is a Vala Siddha Gurut, and other one is the Beheda Siddha Tail. We given this name Timir Anjana and Drushtinasya. And you see on the right side, this is a Netra Prasad Rivati. This is our private formulas we are giving. This whole Timir Anjana, Drushtinasya, Timir Ruta, we made in our factory only. We have a factory. We are using our medicines only for the patients of these all the eye problems. Pathya is very important. Ahara, to avoid jala, milk, curd, sugar. This is very important in ahara and vihara. Ekasthana, asana and divaswap, it should be avoided. Okay. So going to the panchakarma, it is very important in chikitsa. Indriyani mano buddhir vardhasya prasidhati. What is the benefit of panchakarma to the patient? What is the benefit of panchakarma to the diabetic retinopathy patient or diabetic mellitus patient? The patient should feel this is indriyani manobuddhir varnaschasya prasidhati. Means इंद्रिय को प्रसिद्ध means उसको बल मिलने के लिए पंचकर्मा is very important. So jara kuche na labate means in ARMD cases you can use the benefit of panchakarma. It is very important. So indriya prasadana, jara vyadhi, what we said that vishuddha drushti, and in jara vyadhi, ARMD and all retinopathies you use the panchakarma. We already told that virechana is very important. In Timira Avastha, that is a sadhya, flashless floaters. In Kach, Kashta sadhya, all retinopathies come in this category. In Abhishanda, it is a very acute condition. This sadhya in netra. After Dipan Pachan, you can give the virechana to the patient. So, within this Timiram Kacha Sandaha. So, virechana ye conditions mein dena chahiye. So, what about the Basti? Chakshu Prinayati. So, Chakshu Prinayati means enhance the nourishment of the eyes. Like a Madhutelik Basti, you can use the Basti Chikitsa in the diabetic retinopathy. What are the contents of the diabetic retinopathy? Madhutelik Basti is a mother शहद और तेल ये समभाग लेना है आपको. सेंधव, बड़ी शेप, एरंडमूल, इनका निरोह बस्ती बनाना है और इसमें हमको यष्टि मिक्स करना है. इसमें यष्टि मिक्स करने के बाद में ये एरंड मूलादि बस्ती है, वाग्भट ने कहा है. तो एरंड मूलादि बस्ती में ही हम उतने ही मात्रा में जितना कि बड़ी शेप या एरंड मूल का है उतने ही मात्रा में हम जब यष्टि देते हैं, मिक्स करते हैं, तो ये हो जाता है माधुतैलिक बस्ती. सो इट इज वेरी इंपॉर्टेंट in netra and it is a rakta pitta nashak in nature. So it is very important. जैसे आयुर्वेद फिजिशियन बोलते हैं अरे ब्लीडिंग हो गया, विट्रियस हेमरेज है, तो इट इज अ केस ऑफ ऊर्ध्वक रक्त पित्त. नो, that is not a ऊर्ध्वक रक्त पित्त. There is already damage to the vessels of the all retina. That is very important. So it is not a directly rakta pitta, but it is important in rakta pitta nashak. So the other part of our presentation is in diabetic retinopathy, you should think about the prevention. This is very good. This is the balasthana of Ayurveda. There is no any prevention in modern science. This is neglected part by our Shalakyas also, not by the other, but our Shalakyas also is missing this prevention treatment. So what about this? This is a Nidana Parivarjana. When you going to treat the diabetic retinopathy, you should ask if there is a sleep normal or not. There is a threat to the normal sleep. Excessive crying, sorrow, certain situations that becomes hard to digest. This is a avastha of mana. Okay, this is a trauma. Excessive eating of sour and salty. हम बोलते हैं ना कि खट्टा और नमक कम से कम खाओ. ये ऑलरेडी निदान परिवर्जन आचार्य वाग्भट ने कहा है. What I am highlighting here in the red color. Smoking, tendency of sweating, hold omitus. वमन का अवरोध जब करते हैं तो उससे भी आंख की आंख में विजन लॉस्ट हो सकता है. सो प्रोफ्यूज नंबर ऑफ वोमिटिंग, उससे भी होता है. वमन का ज्यादा वमन क्रिया होने से, ज्यादा वेग आने से भी गड़बड़ होती है, या वेग का रोग रखने से भी होती है. These are the two very important aspects in the Nidan Parivarjana. More exposure to see micro objects for a long time. You can see here is you are using the laptops, you are using the mobiles. That is very micro objects. You can see the micro words in the mobiles. Very long time, 5 hours, 6 hours, 10 hours. So this is the most important hetu in this time of era. So you should see the more exposure to see the micro objects for a long time. Vitiated doshas that enters in the eye, that is the last. So what should be the dincharya? So खाने से बचना चाहिए आपको. No one should gaze at the sun for a long time. Should not carry heavy weight on this head. Not see continuously to objects which are in very minute. जैसे बोलते हैं ना, हम जो गोल्ड में काम करते हैं या दागिने बनाते हैं, जो हम तो उसमें उसको माइक्रो ऑब्जर्विंग में उनको आंखों में काफी स्ट्रेस होता है. पहले जब ये सोनारी काम या जो जैसे गहने बनाते हैं हम, तो उसमें जो ये काम करते थे उनको ही ये ज्यादा व्याधि होती थी. लेकिन अभी मोबाइल आने के बाद में एवरीवन इज सी द माइक्रो ऑब्जेक्ट्स. सो द शाइनिंग, डर्टी एंड अनप्लीजेंट यू शुड नॉट सी. और दृष्टि के लिए अहितकारक है, नुकसानदेह है, और ये देखने से हमको बचना चाहिए. तीव्र प्रकाश, चलती वस्तुएं, मूविंग ऑब्जेक्ट्स एंड द यू सी द माइक्रो ऑब्जेक्ट्स. You know everyone, when you should not get the vision damage in your life, you should see these two shlokas. Sarvatmana netra balaya yatnam means what? नेत्र बल उत्तम रखने के लिए. When you are using the mobiles in the 2 hours, 5 hours, 10 hours in a day, or you are the IT person, you should know this importance of the Nasya Anjana Tarpana Day. You should increase the bala or maintain the bala after doing the Nasya Anjana Tarpana. For the IT person, so they should not land in a vision problem. You give for the prevention, you should give the Nasya Anjana and the Tarpana. दृष्टिश्च नष्ट्वा विविधम जगस्य तमोमयम जायत एक रूपम. चक्षुष तेजोमयम तस्य विश्लेषणोभयम योगेत सत्रते सवर्जने रसांजनम. सभी को ये करना चाहिए. Okay, so it is very very important श्लोक. And what Acharya Vagbhata said in Ashtang Sangraha, this is very important श्लोक about the नेत्र रक्षा. आपको आपकी नेत्र रक्षा करने के लिए मोबाइल और लैपटॉप के में से या माइक्रो ऑब्जेक्ट्स जिनके व्यवसाय में है उनसे बचने के लिए, आंख को हमेशा के लिए अच्छे रखने के लिए यू शुड यूज दिस. त्रिफला, रक्तमोक्षण, शरीर शुद्धि लाइक पंचकर्मा, अंजनस्य, पक्षियों का मांस, पैरों की देखभाल, घृतपान, ये सब नेत्र रक्षा के उपाय है. Even in not Triphala is not a simple. It is very important to increase the bal और नेत्र रक्षा करने के लिए. और सबसे important है मन का समाधान. Not only treatment, but you should say the patient for the yoga kriya. You should told the patient for the dhyana. You should show the patient for the meditation also. This is very important. You see, this should be in your retina treatment. Puran Guru, Triphala, Shatavari, Patol, Yav, Avla and Moong. Okay, so इसमें क्या बताया है? नरस्य यत्न्यतो भयम सुघोरान तिमिरम अन्नम विद्यते। ये जो यूज करता है तो सुघोर मीन्स घोर ऐसा जो तिमिर व्याधि है वो भयमुक्त हो जाता है when you use this routinely in your lifestyle, when you are using this. So this is very important. Now, the same you can see here, पटोल काकुड़ा करेला बैंगन करेल फल अरणी एंड सहजन फल, ये घी के साथ तैयार किया गया होना चाहिए. इट शुड नॉट बी विद द तेल, because ghee is important for the eyes. You know this very well. This is also a very important shlok. We are routinely giving this Triphala Gruta, self-prepared Triphala Gruta for the patient. It is very, very important in the diabetic retinopathy also. Why it is important? त्रिफला घृत का हमेशा नित्य सेवन करना चाहिए. यह नेत्र रोग को और खास करके तिमिर व्याधि में उपयुक्त है. त्रिफला मधुसर्पिशाभ्याम निशी नेत्र बलाय च स्वास्थ्यानुवृत्ति उद्देश्च रोगे छेद कर च यत. अष्टांग हृदय में बताया है कि आंखों की मजबूती के लिए रात को शहद और घी के साथ त्रिफला लेना चाहिए, जो स्वास्थ्य को बढ़ावा देता है और नेत्र स्वास्थ्य को या नेत्र बल को बढ़ावा देता है और रोगों से दूर रखता है. So this is about the whole prevention, shaman chikitsa, panchakarma chikitsa, and the whole treatment of your diabetic mellitus plus diabetic retinopathy. Now going towards the evidences, what we are taking in our hospital as a OCT and fundus photograph, especially in the diabetic retinopathy. What the data is between last 8 years. We will show here the evidences. It is in comparison of pre-post OCT images, then pre-post fundus photograph, and for the vision before and after treatment, we should see the evidences after this. Around the data of 120 diabetic retinopathy patients, up to we are extracting in from our data that from the 120 there is a vision improvement is in 28 patients, decreased in 13 patients, vision maintained in 11 patients, and you see the last one, the patient are discontinued the Ayurveda treatment, our treatment. Why? It is due to the patients, due to the its general condition of the DM, general complications of the DM, because not patient is not came only with the diabetic retinopathy, but patients having a treatment of cardiac means cardiologist, treatment having a nephrologist, the treatment having with the neurologist if there is a stroke. So multiple types of treatment is going on at the same time. So due to the general complications of DM, these patients are discontinued. So you see the graph over here, improved patient 54% improvement. You see that 25% of patient even after getting the good his overall condition of the body, still there is a decrease in the vision like 25%, and total maintain is in the 21%. So this is OCT of right eye macula of the 64 years male patient, treatment duration around the 5 years, and vision is improved by 636 to 612. How we will treat the 5 years? Have you counsel the patient that you should need this treatment for a long time? So you should know the samprati of diabetic mellitus. You should know the chikitsa of the diabetic mellitus. You should know the long duration of the diabetic mellitus. So you should convince the patient, counsel the patient, you need the diabetic treatment as a shamana chikitsa, including panchakarma and the netra karmas. Okay, and in panchakarma especially nitya virechana. So the patient came at this age patient does not feel improvement in the vision directly. So how you counsel the patient? How you counsel the patient that how you get the vision improvement, in which stage, and how many months, how many years you will get the improvement? So you should counsel the patient that when we are giving the treatment for the diabetic retinopathy, you feel first the increase in your sharira bala in the first. First you see the improvement in the grahani. First you improvement in the sharira bala. Increase the sharira bala, that we are going to the right direction of the diabetic retinopathy treatment. When the medicine is entered inside the body, so the medicine see the effect on the other parts of our body. First, especially starting from the amashaya, increase the appetite, decrease the acidity, bowel is okay, sleep is okay. If there is a insomnia, you should treat this first. Then your treatment will act on the diabetic retinopathy. Otherwise, these 5 years you cannot counsel the patient. You may lose the patient. Not you lost the patient. Patient will lose permanent visual loss, because there is only treatment in Ayurveda. We can at least preserve the vision, not only gaining at every patient, but we should preserve the vision as it is. If patient bala is very less, you should try to maintain the vision, or otherwise patient having a very low bala, you can slow down the diminish of the vision. You can slow down the process of diminished vision. This is the importance of Ayurveda. The vision improvement is 6/36 to 6/12. Now patient feeling a 6/9 is right eye. Okay, this is a right eye. So same patient on the left eye, this is a diabetic macular edema. What we already seen this patient when we started our presentation, the same, there is after 5 years there is no response for the left eye. You can see the conditions. You can see the date also. This is 17/8/2018, but this is a middle one, 2021. You see we see the same improvement in the next slide. The same patient, okay, when in the 6th year, from 2018 to 2024, you can see the date over here, 10/4/2014. Total macular edema is gone. Same patient, but there is only 5 feet vision after subsiding the diabetic macular edema. Why this happen? When there is a long-standing diabetic macular edema, there is a loss of your dhatus also. They are functioning dhatus also. Their functioning is lost. Edema will subside, but the dhatus function is lost. So you can see on the left side huge macular edema. On the right side, you can see at the macular edema what OCT shows. There is a RPE degeneration, और RPE सब जो लेयर है आपको वो बहुत RPE thin हो गया है. Means there is a loss of dhatus also. There is only a 5 feet vision after. So you should try to reduce the edema as early as possible. But the condition is not like the same in the OPD. When Rugnabala is less, you cannot treat. You should tell the patient that whatever we are giving the treatment, if patient subside the general symptoms, then diabetic retinopathy will subside early. Otherwise, diabetic retinopathy is not subside, macular edema is subside not early, then he may lose the permanent visual loss. The same patient, you can see this is the progressive analysis of the same left eye. You can see there is a red spot in the first visit, and going towards the progression on the last side, you can see there is no any red mark. See, totally, you can see the OCT images also. You can see the graph where my cursor is. You can see when the patient is come around, macular edema is around in between 500 to 750 microns. But it is after Ayurveda treatment, it is goes on increasing up to the 2020. You can see, yeah, after 2021, there is a slope decreasing of the macular edema. You can see the subsequently on the upper dates that after 2020 it is goes steadily decreasing, and you see there is a 125 microns, means there is a retinal pigment epithelium damage. वो 250 रहता था, तो yes, there may be a good vision, but there is a RPE degeneration also, so there is only a 5 feet vision. You see the graph is very well. On the right side, my cursor, you can see the decrease in the macular thickness, that is only 63. You can see in the other there is a macular edema. So this is a graphical presentation by OCT. The other patient of NPDR, pre and post. You can see the visits 2018 to 2020. You can see my cursor over here. You can see the macular edema over here. Over here also, you can see the whitish grayish color that is totally subsided over here. Okay. It requires around 2 years of treatment. A vision improved by 624 to 69 in both eyes after 2 years of treatment. And you can see the huge macular edema over here. Okay, you see the grayish color over here, and it is totally subside over here after the 2 years of treatment. This is the case of NPDR. So this is the case of DME, NPDR. This is a progressive analysis. This is from March 2029 to July 2019. This is a 4 month of treatment. Decreased macular edema and vision is increased by 645 partial up to the 6/9. This is also within 4 months. You can see there is a decrease in the macular edema. This is the first visit, and you can see the visits 2, 3, 4, 5, and the last 6. Still, there is some macular edema, but patient having a 6/9 vision. You see the large macular edema is decreased within a 4 month. But you can see if there is a Rugnabala is Uttama, so you can increase the dose of Shaman Chikitsa, increase the frequency of Nitya Virechana after 1.5.
So you're not audible. Hemant sir?
Condition. You may have the repeated Kostashodhana after 2 months or 3 months. You see the improvement in the progressive analysis. Now, this patient of DME, you can see first there when patient comes to our hospital, that anti-VEGF it is already taken. So macular edema is reduced by the anti-VEGF. But after discontinuing the anti-VEGF, when we shifted to the Ayurveda treatment, still there is an increase in macular edema. Because why it is decreased? It is due to the anti-VEGF. When you start the treatment, your anti-VEGF effect is gone, and patient is on the Ayurveda treatment. But localized edema, anti-VEGF is gone due to the anti-VEGF. So if the effect of anti-VEGF is subside, there is increase in the macular edema. But at the same time, we can start the Ayurveda treatment. What patient feels? अरे आपने आपका आयुर्वेद सर ट्रीटमेंट आपने शुरू किया और मेरा एडिमा बढ़ गया सर, हम मुझे क्या करना है अभी? So you should not fear. You counsel the patient that there is your tendency of recurrent macular edema due to the long-standing prameha, the long-standing diabetes. So started with 6 months to 1 year, around 1.5 years, when our treatment is acted to your whole body as a prameya chikitsa, then the edema may be reduced after 6 months, after 1 year, or it may take after 1.5 years. So you should counsel the patient first. There may be a decreased, increased, and decreased pattern when your treatment is going on. If you are not counseling the patient like this way, you may, our patient also may lost his vision completely, and patient may lost the Ayurveda treatment. It is good for his life also, not only the eyes, but his further life of diabetic complications. So all the diabetic complications, when you give the Prameya Chikitsa, your peripheral neuropathy should come down. ये पेशेंट्स कभी कभी चिमचिमायन या कभी कभी बाधिरिया फीलिंग करता है पैरों में, तो वो पहले ट्रीट होता है. If your chimchimayan and badire is goes, you should told the patient that your retinopathy will go in the future also, because our treatment is acting on the whole body. So you see there is on the graph lower side, where is my cursor? There is below 250. Then after 2 years treatment, there is a macular edema. You can see the increase in 2023. Okay, middle of 2023 and 22. Okay, and you see there is a reduce of macular edema. You see the subsiding. Now the last visit is in the 2024. So this is a total gain of vision around 6/9, up to the 6/9. See the other patient also, same pattern, decreased, increased, and decreased from 6/45 to 6/9. You see this red spot is goes and in the last visit, and you see the trend. Where is my cursor is? You can see the central sector. The edema is 625 micron. You see, when we start the Ayurveda treatment, the patient feels the improvement in the vision. There is a steadiness of vision. There is the same vision around the 2 years. Then after 23, you can see the steadily decrease the macular edema. So these fluctuations is always there, because the patient doshas is in the sthana vaigunya. Sthana vaigunya is there, and sthira guna of doshas, क्योंकि दोष वहां पे रेटिना में वहां ही बैठे हुए रहते हैं, स्थिर गुना से रहते हैं, वो तुरंत निकलते नहीं है. कुछ हेतु हो जाता है तो तुरंत मैक्युलर एडिमा बढ़ता है. If hetu is subside, then you can see after the treatment also, and to avoid the hetu, after that you can see the subside. Okay, this is the improvement in the 6/45 to 6/9. So the same pattern, decreased, increased, decreased. Okay, and progressive analysis for the right eye, the treatment period is 2 years, 21 to 23, 44 years female. So you can see on the graphical side, you can see the trend. When we started the treatment, after you can see after 21 to 20, the end of 23, you can see the same stage. In between, there is an increase in macular edema after Ayurveda treatment also. So you should, what is the importance in this? You should counsel the patient. The counsel is very important in the diabetic retinopathy treatment by the Ayurveda. Okay, you see in 2024, there is a decrease in the vision. You see, this is a thinning. The edema is goes. You see the date and microns. The macular edema is decreased. This is only decreased, not increased in this case. Pre and post. You see, these art exudates is totally goes over here. And a patient is within a 4 months, patient having a good relief, 6/18 to 6/9. This is a progressive, this is a 18 months treatment. Right eye edema steadily decreased from 636 to 6/9. You can see very large over macular edema over here. You can see the graph. It is steadily come down. It is not increased in between. Okay, because patient having a very good health. That's why there is no any fluctuation in the doshas. The same patient is left eye. You can see over here the huge macular edema around 375, and this is steadily goes after 2 years of treatment, around 1.5 years of treatment. You can see here in grayscale, you see the edema, and the last you can see over here the patient having from 660 to 69. I operated this patient for the cataract also, bilateral cataract also. Now patient is in healthy condition. His eye is totally in good condition, 6/9, both eyes. And the last one is the photographs, pre and post. So you can see the hard exudates plus edema is gone. This is the pre condition, and you see in the lower side that exudates is gone over here. You see the hemorrhages at my cursor, and the this is hard exudates, which is totally gone over here. But still there is a scattered hard exudates over here. Okay, but you see over here at my cursor, there is a loss of dhatus over here. So the scotoma is always present in the long-standing diabetic retinopathy patients. This is a very 85 years old female. When she is came to us, you see the conditions over here. Okay, she is having lasers, anti-VGFs, and all these things. When first time see her, you can see there is a hemorrhages nearby optic disc, and you see the damage or hard exudates and everywhere. Okay, and after a very long treatment, around more than 15 years, you see you see on the post treatment, but there is no any hemorrhage, there is no any proliferation, there is no any tractional retinal detachment or epiretinal membranes or vitreal membranes. There is nothing, any complications due to the Ayurveda treatment. Patient loses her vision, but she is independent. She is not completely blind, or otherwise after 15 years patient may land in the PDR and the tractional retinal detachment, patient may blind. You see, at every patient you cannot expect the always positive results, but you can prevent that patient going towards the blindness. This is very important slide for you. And you see is a very good fundus photograph. You see there is a micro hemorrhages, and the hemorrhages also intraretinal hemorrhages. This is a soft cotton wool appearance is totally gone over in this photograph. The patient having the vision 6/18 to 6/6. So here is the same condition. You can see on the left side pre and the post condition, macroedema and the otherwise. You see the pre and post, same after Ayurveda treatment. So the evidences we are taking at our hospital, that is equipped by all these equipments. There is a topographer from Italy, that is a CSO. This is optopal OCT is available. Zeiss perimetry is there. The phoropter, we are taking a vision with phoropters, and Alcon phaco machine is there with Zeiss microscope. At every Thursday, we are doing the concessional surgeries. Around 15 to 20 SICS surgeries are there. And in the Tuesday and Saturday, our private surgical day is there. Around 8 to 10 patients, phaco surgery patients, we are doing regularly. Today is the diabetic related with the diabetic retinopathy treatment presentation. We have the keratoconus, management of glaucoma, management of uveitis, management of allergic eye diseases, management of progressive myopia in the childs, in the condition of keratoconus, what we said already. There is a very good results by Ayurveda itself only. What is my message is that take home message. Modern studies found that 1 out of 3 having low vision up to 2015. Most of the disease have symptomatic relief in the modern science, and chances of reoccurrence or recurrence is there. No treatment to stop further loss of vision. This is the modern science. What about the Ayurveda? You see, if there is a Patalgata condition, third Patalgata, prevention is the balasthana of Ayurveda. And for the cure, it is from its root cause. So there is no, when the macular edema is subside, there is no recurrence of macular edema absolutely afterwards. This is cure from its root cause. Hence, no chance of reoccurrence or recurrence, and stop further loss of vision. And what you expect at the end, you see the family on the right side. Vision, drushti, matters for the independent, happy life. Okay. And what about the last slide, conclusion? So to maintain the structural means the retinal structural, and the functional means the vision. The structural and functional properties, the above state should be efficiently kept balanced. What is the balance condition? Vata, Pitta and Kapha should be maintained at all. Okay. And Acharya aptly conclude that the structural and functional changes in the eye is nothing but the changes in the properties of Sapta Dhatus and Tridoshas. So you are treating the diabetic retinopathy. Keep in mind, in your mind, that you should, there is a changes in the properties of Sapta Dhatus and Tridoshas. You should treat this. You should treat the Sapta Dhatus. You increase the bala to increase the Dhatu bala to and eliminate the Tridoshas by Panchakarma and the Shamana Chikitsa. So it should be concluded afterwards. And what is the last? But predominantly, what we can say, that Agni is important and Kapha having a constant threat to the eye. So Agni Mandya and Kapha is what the Kapha is initial stages. There is a Kapha Avastha. So you should treat the first. This is the conclusion of our diabetic retinopathy presentation. This is our Guru, Dr. Nana Joshi from Dhule. We can हम ये जो प्रेजेंटेशन है आज का हम समर्पित करते हैं हमारे गुरु को. So these are the references. So thank you for this is a very long presentation. Why it is long? So every Shalaki should know the concept how to treat the diabetic retinopathy. Not only the evidences, but everyone. So there is every Shalaki should have the OCTs, should have the your topographies in your the fundus photographs. For the glaucoma, you should have the especially size perimetry, because it is a gold standard perimetry. So the message is that every Shalaki should need this for the evidence-based practice, and your Ayurveda treatment and your Netra Ayurveda Chikitsa should come forward for the benefit of our people in India and the outside the world also. Thank you for quite listening. Thank you for to all the Vishwa Parishad, Ayurved Parishad, that inviting me over here, Dr. Magar Madam, Vyas sir, and Latika Madam, Arun Kumarji. Thank to everyone. Thank you once again.
Thank you. Thank you so much, sir, for such an engaging and very much well documented and evidence based presentation. Now, I request Dr. Veena Sharma, ma'am, Associate Professor and HOD Shalakya, MSM Institute of Ayurveda, to kindly give their remarks or such an insightful presentation. Ma'am, please.
थैंक यू डॉक्टर लतिका. विश्व आयुर्वेद परिषद के सभी राष्ट्रीय एवं राज्य पदाधिकारियों को मेरा नमन. नेत्रायु आयुर्वेद हॉस्पिटल इन जलगांव डॉक्टर हेमंत बाविस्कर सर ने लगभग अपने 30 वर्षों का अनुभव हमारे साथ शेयर किया है। सर का स्ट्रगलिंग भी मैंने देखा है, जब मैं भी स्ट्रगलिंग कर रही थी तब। तो सर ने आयुर्वेद नेत्र रोग में बहुत अच्छा नाम किया है, ये मुझे बहुत अच्छा लगा। सर ने जो विचार हमारे साथ साझा किए कि किसी भी पेशेंट को काय चिकित्सक बन के ही शलाकी ने ट्रीट करना चाहिए। ये बहुत बेसिक कंसेप्ट है जो हम सभी शलाकियों ने इसको ध्यान में रखना चाहिए। सर ने बताया कि पेशेंट को जब भी ट्रीट करें हम दीपन पाचन का विचार करें, मोक्षण करें तभी आमावस्था निरामावस्था का ध्यान करें। कोश शुद्धि नित्य होनी चाहिए पेशेंट के साथ में हमारी, कि पेशेंट को पर्गेटिव चिकित्सा हम करें। पुराण घृत का उपयोग करें, क्रियाकल्पों का उपयोग करें, नेत्रधारा विडालक वगैरह, दिनचर्या ऋतुचर्या, निदान परिवर्जन, इसको ध्यान में रख के चिकित्सा करें हम। पंचकर्म बहुत अच्छी चिकित्सा है जिसको हमने ध्यान में रख के ही चिकित्सा करनी। नेत्र व्याधि उपशम मिलेगा पेशेंट को और हम अच्छे कर पाएंगे सभी चीजों को। क्लिनिक के अंदर जो मॉडर्न इक्विपमेंट और इंस्ट्रूमेंट है वो भी है और और अच्छा और मॉडर्न कंसेप्ट सर ने हुआ है जिससे कि वो कंपैरेटिव स्टडी करके हमें डायबिटिक रेटिनोपैथी के बारे में। तो सभी शल्यकियों के लिए मैं एक कहना चाहूंगी कि चेहरे को ही नहीं अपने व्यक्तित्व और व्यवहार को खूबसूरत बनाओ, बिना डरे और बिना रुके बस आगे बढ़ते जाओ। यही के साथ में सभी का धन्यवाद। थैंक यू।
Thank you so much. Thank you so much, Veena ma'am. We had two questions, sir. One question was that which drug we can use for Nitya Virechana in diabetic retinopathy?
Yes, we are using that before going to give the Koshta Shuddhana or the Virechana. You should know the which Koshta patient has, the Madhyam, Krura Koshta or the Mrudu Koshta. If you have a Mrudu Koshta, you can use the Triruta Avleha, okay, around 20 to 30 grams at a time, 30 grams or more than that you can use, okay. Or in Krura Koshta, you may use the Ichha Vediras or the other purgatives also, no any problem. But especially we are using the Trirut Avleha, which is soft in nature and it is not giving the many more complications.
Okay. So now I request Dr. Arun to please conclude the session with Shanti part also.
थैंक यू डॉक्टर लतिका और थैंक यू सभी हमारे लिसनर्स जितने भी थे और आज मोर देन 120 लोगों ने हमें ज्वाइन किया और थैंक्स वेरी मच। और शालक के परिवार ऐसे ही हमारे साथ जुड़ता रहेगा और हम ऐसे ही हर महीने एक नए अपने शालक के एक्सपर्ट ने जो सीनियर शालक के एक्सपर्ट है उनको सुनते रहेंगे और नई नई शालक के में हम लोग ऐसे ही अपने नॉलेज को अपडेट करते रहेंगे। तो थैंक यू वेरी मच सर फॉर योर नाइस और
थैंक यू
प्रेजेंटेशन और इतना वैल्यूएबल नॉलेज के लिए। सो दिस कंक्लूडिंग टाइम। सो हम लोग सभी शांति मंत्र के साथ अपने आज के इस कार्यक्रम सफल कार्यक्रम का ये तो सभी ज्वाइन करें प्लीज मुझे। ओम सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति। Thank you very much, ma'am. Thank you, Nita, ma'am.
Thank you very much.
Thank you, ma'am. Thank you, sir.
Thank you, sir.
Thank you, all of you. joining us.
Thank
We
you,
would,
sir.
Hemant sir,
Thank you, sir.
हाँ जी.
definitely we would like to visit your hospital Jalgaon. मैं मेरे
Oh,
पोस्ट ग्रेजुएट स्टूडेंट को भी बताया है कि we should visit, एक कंपल्सरी विजिट होना चाहिए
हाँ
उत्तराखंड
हाँ.
के भी लोगों के स्टूडेंट के
प्लीज
लिए
सर, हम
और यहाँ
नॉर्थ
के भी.
नॉर्थ वालों के लिए सर प्लीज एक विजिट बनाइए सर, प्लीज हम लोग सीखना चाहते
बिल्कुल
हैं.
बिल्कुल, आप बना सकते हैं एक 2 दिन का. एक नहीं तो एक कर सकते हैं विद इन अ विजिट. You can keep the half a day conference of any subject. It's okay.
Sure, sure,
So,
sure.
and it is on Ayurveda only. Okay.
Okay, okay, sir.
You may tell the subject. We will do all the arrangements, and one a short only 2 lectures of
I will,
1.5 hour, and the hospital visits, and
sir,
just we will see how we will see the patient directly to at our hospital. No
Sure,
any
sure.
we
problem.
will chalk out the
Thanks, sir.
program. We will completely chalk out the program, and I will communicate you. We will speak later on, and we will definitely something will good. We should not stop merely just listening a lecture. One step ahead we should go, and we will be there. Our communication should be there in future also for
Yeah,
the
yes,
younger Shalakis. Yeah, that's
yes.
what I was. My wish
No,
is.
we need
Thank you.
now where we are uh,
Hmm.
at our
Definitely, sir. Fellowship. Do you have a fellowship course in your
no,
posterior
no,
segment just now?
not now, but in future, when we go ahead, still we have a keratoconus,
Okay.
glaucoma, and the diabetic retinopathy. These are the
But
departments,
you
different
you
departments.
you can design a fellowship course for a posterior segment
Yes,
or
yes, no,
especially
no,
for diabetic retinopathy. Just
yes,
like Mangesh sir has shaped up this rheumatologist, no? Rheumatoid arthritis, there is a fellowship course.
yes,
In the
yes.
similar manner, you can also have your fellowship course in diabetic retinopathy or posterior segment. त्याचं ते स्टडी और ये सब मैं बताऊंगी सर आपको. So
हाँ, जरूर
thank you very
जरूर.
much. Okay, sir.
Yes,
Thank
yes,
you,
always,
thank you.
always. You
Okay,
can
okay.
give
Hello.
me the whole protocol. Then we will
Yeah,
go ahead. No any problem.
definitely. Okay,
This
sir.
is go
Yes.
by hand in hand. It is not a work of a single man.
Yeah, yeah.
Yes, yes.
Thank you.
Okay,
Akhila,
thank
you
you.
want to ask a question?
Hello.
Yes, yes.
Hello, sir. Namaste, sir.
हाँ,
Akhila
ma'am.
here.
Okay, okay. Yes, yes, madam.
Sir. Thank you so much that I can hear you once again. It was
Yes,
very wonderful section, and I have already witnessed for so many miracle cases that happened at that time when I was in deputation. Thank you
yes,
so
yes,
much.
yes, yes.
Thank you, sir.
Yeah, yeah. Thank you once
Okay,
again.
thank you so much, sir.
Good night.
Thank
Thank
you,
you. Good
ma'am. Thank
night
you,
to all of
everyone. So
Thank
you.
you, sir.
we are
Baviskar,
ending this
You.
sir,
session.
thank you
Thank
so
you,
much
Dr.
for
Lotika.
Thank
being the
you,
great
thank
journey.
you,
Veena
thank you.
ma'am, Sunita ma'am, especially thank you. Arranging such
Thank you,
nice
sir.
No, no.
Thank you
आपलं
so much, sir.
फ्रिक्वेंटली कम्युनिकेशन पाहिजे. सो आयसोलेशन मध्ये जायचं नाही. देर शुड बी फ्रिक्वेंट कम्युनिकेशन अँड वी डेफिनेटली आय विल मेक अ प्लॅन ऑफ फॉर इट.
No,
गुड
no.
नाईट सर. थँक्यू.
Anyone need help of any patient? Okay.
या
Just
डेफिनेटली.
WhatsApp me. What should be the line of treatment? I will convey from here. No any problem.
ओके सर. थँक्यू.
Thank you, sir.
Yes, yes, yes. Thank you once
Sir,
again.
shall we end the meet then?
Yes, yes. Thank you once
Okay,
again.
thank you so
Thank you.
much, sir.
Thank you.
Thank you so much.
Thank you.
Okay,
Sir.
sir. Okay, ma'am.
ओके सर. बाय लतिका.
Thank you, Veena ma'am.
Okay, ma'am.
Thank you, sir. Thank you so much.
Yes, yes. So kind of you to see here once again.
Thank you. Thank you.
I recall the Poddar days, Veena madam.
Yes, madam. Yes.
बुलाइए हमें वहां पे उत्तराखंड में या बॉम्बे बॉम्बे से.
हाँ,
ओके
Yes.
बाय.
बराबर
Thank you.
बराबर
Thank you once again.
Thank you.